Okay, now as you can see, this is the lateral view of an embryo of 4 weeks. Okay, here you see that this is the cephalic end showing the prosencephalon area of the brain, and this is the nasal placard, and you can see the pharyngeal arches all around. This is the cardiac bulge, and this region in between the cephalic end and the heart bulge is called as stomodium, the future mouth, right? Okay, now you have seen that this is the lateral view of the embryo, but this region is being cut, cephalic region, to show you the internal placement of the pharyngeal arches. That was, of course, the brain vesicle or prosencephalon area, and these are the respected pharyngeal arches. Arch number 1, pharyngeal arch number 2, 3, 4, and 6, respectively, right? Now, these are the somatomeres and the somites, and you can see the cardiac bulge. This is the frontonasal prominence showing the nasal placard, and in between there is a stomodium, usually being covered by the oropharyngeal membrane, right? Now we are interested here to see that how the embryo grows. It grows on the rostrocaudal axis as well, and also on the lateral axis. And we are interested in the facial development. So we have to know that which are the organizing center. One of the center that organizes the development of face rests at the precaudal mesoderm. And if you imagine that this is the cephalic end, this probable portion that comes this in relation to the cranial, and we can have the underlying mesoderm, its most anterior portion labeled as precordial mesoderm, that takes part in the muscular development of the face muscles. Let's see some other picture. Okay, this picture will help you out to see that this is the neural plate, the future neural tube, and just rostral to it, there lies the precordial plate that would be involved in the prosencephalic organizing center for the muscular development of the face as well. This diagram will show you the migration of the neural crest cells that are present along the neural grooves all over the body. They are moving or migrating towards their destiny area for the development of the different structures. You can see that they are coming from the prosencephalic area, the mesencephalic and rhombencephalic, most probably in between the mesencephalic and rhombencephalic areas. These organizing center directs these neural crest cells to reach in the respected areas and form the structures regarding your head and neck. Okay, now you can see that this is an embryo and you are looking from the ventral view. The region of the face will be showing 5 swellings. Among them, the frontonasal prominence or swelling or process is unpaired, and then you can see that there are other swellings, the maxillary swellings or prominence on both sides, they are paired, and this is the region called as stomodium, the future mouth. So these maxillary processes are around the stomodium as a lateral boundary, and you can see the mandibular prominences, they are forming the inferior boundary of the stomodium, and of course the frontonasal prominence come as a cranial boundary of this stomodium, right? Now see what happens next, that we see that there lie the nasal placard, and these are the thick ectodermal ridges. They are now transformed into nasal pits through the horseshoe-shaped swelling made up of mesenchyme, and this is being made via the frontonasal prominence. They create the medial nasal prominence and the lateral nasal prominence, and when they bulge, they cause the placard or convert it into nasal pits, right? Okay, now this picture will illustrate you very well the frontonasal prominence, right? That forms the forehead and the bridge of the nose, right? And these are both the nasal pits being wrapped up on its medial side by the medial nasal prominences, and on lateral side the lateral nasal prominences in green. Okay, what you see next, this area is the stomodium, and this is bounded laterally by the maxillary prominences, and below of course there is the mandibular prominence, which is being fused or merged in the center. So we can see that the lower lip and the lower jaw is first to develop because the mandibular prominences, they both merge at the very start. Now here this picture will make you clear that the maxillary processes, they are now moving medially, and in this way they are merging with the medial nasal prominences on both sides. And concentrate, let me make it a little bit more enlarged. Now you can see that there lies a cleft or groove between the maxillary process and the lateral nasal process. This groove is called as nasolacrimal groove, right? This is these are the future eyes, and this is the of course nose. So a groove in between will be the nasolacrimal groove, and we know that it is due to the proliferation of the ectoderm that forms the uh, rod-like structure, and later on apoptosis occur in the solid cord and convert it into a canalizing duct inside, and we label it as nasolacrimal duct. Of course it's cranial and will be joining the lacrimal fossa gland of the eye, and medially it will finally open into the lateral wall of the nose behind the inferior concha. Okay, now we'll see the next picture. Okay, now in this diagram, you have seen that the this medial two prominences, they have merged in the midline to form a median merged nasal prominence, and they are now forming the dorsum of your nose, the tip of the nose, and let's see what else they are going to form. In this picture, they have grown a bit more, and they are taking part in the formation of philtrum. But before the formation, as they have merged, they will create the intermaxillary segment, and this is the intermaxillary segment that is giving rise to the philtrum. Not on the philtrum, rather the upper lip lower region. If you enter inside, the interior will be showing the upper jaw rather, with the four incisive teeth. And if we go more interior to it, we can have the view of the hard palate, and its initial primary palate triangular area is also being derived from this intermaxillary segment. And now you have seen that these maxillary processes have approached or merged with the medial nasal prominences, and finally they are also making you would say this link with the mandibular process, and in this way they are forming your cheeks and the upper lip and upper jaw, and the mandibular process have already made your lower jaw and lower lip, right? So now again concentrate on the picture. You can see five prominences around the stomodium. Now here you have observed the nasal placard with the horseshoe swellings. Now you can see that laterally the optic placards are there for the future eyes, and here a proper shape of nose has developed, and you can see the eyes, they have shifted from the lateral aspect now anteriorly, right? And now you can see the purple maxillary prominence on lateral aspect and the mandibular prominence, and a very close picture to show you that real embryo looks like this. The nose is there, the nostrils are there, the philtrum is there, and this is the place of eyes, and cheeks and upper jaw by the maxillary process and lower jaw by the mandibular process, right? Okay, now this picture at week 6. will make you clear that initially the two medial nasal prominences, they are merging to form intermaxillary segment. Finally, when this has developed, this will form the philtrum of your this region between the nose and the upper lip. And let me show you another picture, that if you observe the inner aspect, you see if there is a jaw showing the upper four incisive teeth, and after that you can see the primary palate being developed by the intermaxillary segment. Now you can see that what happens next as we are looking through the cut section of the embryo and viewing inferiorly. So we can see that these are the maxillary processes, and they give the lateral palatine shelves on both sides. They will move or grow inframedially, first superior to the tongue, but later on the cephalic development of the head leads to the tongue, which will be shifting more downward due to its pull by the body axis, you would say. And the palatine shelves, they assume the horizontal position, and this region is showing the nasal septum. When they will fuse, their nasal septum will also get attached on the or fuse with the superior surface of this secondary plates, forming the hard palate, or we call them as secondary palates, right? Now in this picture you can see that the primary palate is there and the secondary palates, they have completed their fusion as a palatine shelves, and this is the hard palate, and the unossified posterior portion becomes the soft palate, right? Now through this picture we are able to see that developmental phase takes week 6 up to the 12-week time, and that could be considered at critical or vulnerable period for the palate and face development. So any pathology can occur during this time period. Now this picture will show you that intermaxillary segment, how it formed the philtrum. Then it formed the upper jaw with the four incisive teeth and the primary palate as a triangular area. Finally, you see these fused palatine plates. They are making a Y-shaped suture in between the primary palate and the secondary palate to become a hard palate. So that is the concept about that why palatine shelf first elevated, first moved medially and inferiorly, then elevated due to the extrinsic force of the jaw, tongue, and head position, or intrinsic forces due to hydration of the ground substance and other mesenchymal cell activity. They contribute in the movement of palatine shelves, right? Now this picture will show you that this is the front of the embryo, frontonasal prominence. This is the stomodium, nasal placards being cut here, and you can see this is the forebrain. This is the mesenchyme derived from the mesoderm, and these are the ectodermal thick ridges to form nasal placard. Now they are being converted into nasal pit because the sides are being elevated to form the medial and lateral prominences. So see how this pit is transformed into nasal sac with the growth of medial and lateral prominences, right? Now, as you can see that there are various sinuses, the maxillary sinus, the frontal sinus, the sphenoidal air sinus, and ethmoidal air cells. They also develop, but among them, the maxillary sinus is first to develop during embryological life, and rest of them developed after the birth. They are the air containing cavities, adding resonance to the voice and give shape to the face. Now in this picture you can see the lateral wall of the nose showing various elevations, and we can see that they are superior, middle, and inferior nasal concas produced due to the bulging or diverticula in the walls of the nose, and giving these protuberances. Okay, now if we see that there is a sagittal cut section, we see this is the nasal sac, this is the wall of the brain, this is the oral cavity. So intervening structure is definitely the primary palate, that triangular palate formed by the intermaxillary segment. Now you can see the depth of this nasal sac. In between there lies a oronasal membrane separating the two cavities. Then there would be the rupturing of this oronasal membrane, creating a communication between the nasal and the oral cavity, and this is called as primordial choana. Initially there is epithelial plug formed by the inside epithelial proliferation that later on disintegrate. Then we see that the primary palate is there. Now the secondary palate is also there, forming the complete hard palate, and the posterior most unossified part is known as soft palate. Now you can see the lateral wall is addressing the nasal nasal concas, and the region behind this nasal cavity and the oral cavity where they both can communicate is the choana. And now we can see this is the pharynx. This is the oropharynx portion, right? Now this diagram will show you that how the Marsh median process has produced the primary palate, and how these secondary palates they are approximated to form a midline suture, and here they are near completion to form the process of formation of hard palate, and most posterior is the soft palate, right? This diagram will show us that if there is a groove left in between the maxillary process and the medial nasal processes, and involving your alveolar process, and in this picture bilateral picture of this is being shown, so we could be having different types of cleft lips. This is unilateral complete cleft lip, this is a bilateral complete cleft lip, but when it involves your palate, so here we can see unilateral cleft palate as well, and here you get the bilateral cleft palate as well along with the cleft lips, right? And this is a real-time picture to show you that congenitally there could be the birth defects of the lip and the palate. Patient can be presented like this with the unilateral cleft lip and cleft palate. So this resembles with that of a hair lip. I will show you the picture as well. This is histological view, and this is the picture uh, of a baby showing unilateral cleft lip. This is the scan electron graph to show the development of the face. Again, a picture showing the pathologies. This is a picture to make you clear that the cleft lip resembles with the hair lip.